Dr. Lauren Olsen is a pediatric resident in Las Vegas. Becoming a doctor is a 10-year plus commitment between undergrad, medical school, and residency. I've known Lauren since my sophomore year of college. We are in our early 30s now, so that means that we've been friends for over 10 years now, and I was able to see her journey from undergrad all the way through residency. It's been 10 plus years. Lauren, let's talk about the journey of becoming a doctor, if you will entertain us with that.
Absolutely. I'm so excited to be here. Excited to see that you're on your 14th episode of this podcast. Remember your first one, so it's very exciting.
Awesome. Yeah. So we've come a long way. So I mean, well, let's take it from the top, which is when did you know, when did you first dream of becoming a doctor?
So a lot of people either find out really early on, or they were told they should be a doctor, or they find out later in life. I would say for me, I originally wanted to be a veterinarian, and I was allergic to cats, so that wasn't going to quite work out, but I was always excited about science and learning about the human body. And what really solidified the doctor thing was actually my mom being pregnant with my sister, who's now 19. And she had some issues with miscarriages prior to that. And so I was a very invested 11-year-old and very anxious about, is the baby okay? So my mom actually took me to some of the appointments to her high-risk doctor, and they found out that I was interested in science and stuff. So they let me, actually look at the ultrasound, see my sister on the ultrasound and stuff like that. So that really solidified it. Becoming a doctor was that for me. And then pediatrician was still with my sisters, actually. When we were older, I often went to the doctor with them, and we had our three kids did the doctor appointment, a teenager and 2 babies after my other sister was born. And we had a really good pediatrician named Dr. Boston. And she really encouraged me a lot to keep working hard. And and it was pretty easy because my mom's side, that's Puerto Rican, there's actually a lot of doctors on her side of the family from Puerto Rico. So it was a natural fit and highly encouraged as soon as I said it. So as soon as you say you want to become a doctor, no one tells you not to.
Awesome. Yeah. So you're 11 years old. How do you actually take it from there? You say you want to be a doctor. You're 11 years old. You're in 5th grade. What do you do next? What did you do?
So you really do need to work pretty hard starting early. So with that, in Jacksonville, Florida, where we're from, I was zoned for a high school that didn't. In Florida, they do the grading system. So it didn't have a good grade. It was like a D school at the time, Sandalwood. And so I knew that in order to get into a good college and then good med school, I needed to go to a high school that I could get good grades and be challenged. And so at the time they had the IB program. So I applied to it in middle school. So I started pretty early thinking, okay, if I'm going to be a doctor, I need to go to a good high school, a good university, so I can get in. That was always the ultimate goal. So usually med students, they really start in high school. So if you're taking AP credits, you're doing IB credits, you're applying to colleges that maybe there's an honors program or something like that, and you're applying a lot of your credits to college. So it starts early on.
Wow. Okay. So one of my beefs with my doctor friends is you guys seem like this is because it all starts so early like this, and it's like a multi-year commitment. It starts in high school. My beef with people who are doctors is you guys seem very unidimensional. It's very often that you don't have any hobbies. This is just my perception. So
yeah. No, we're all the same. Well, I'm not. I don't think of myself as the same. I definitely classify myself as the most non-traditional medical student you'll meet, and somehow
Why
I'm
is
still a
that?
resident. Um, so in college, so I, got to college and stuff, and I ended up staying actually near home for personal reasons and family reasons. And the fact that I did get a lot of money from the local university, that helped a lot. I actually decided to become a Spanish major and dropped the biology major part after they told me I couldn't study abroad. I'd have to stay to do certain biology classes to finish on time for that degree. And at UNF, their major point of study in bio was grasshoppers and gopher tortoises. And I was like, F that. I'm going to go to Spain and learn a language and have a lot of fun, because my goal is medical school and I'm never going to have fun again for the rest of my life, was kind of my thought. So,
Okay.
So I did that, and that tends to be a non-traditional route because you don't have as many hard science classes. But as long as you do your prereqs and you take the entrance exam, which is the MCAT, you can apply to any med school.
Okay, yeah. So when I met people in college, they'd always be like, "Oh, I'm pre-med," and that usually meant like they were either biochem or biology. You were biology. So what does pre-med mean if you were a Spanish major? How does that add up?
So pre-med, all it means is that you're taking the prerequisites to apply to medical school. So there's basic requisites that you have to take, and they're very similar to PA school, or if you're applying to not nurse practitioner, for veterinarian school, those types of schoolings, you have to do physics, biology, chemistry, you do organic chem. Now they have other requirements too. They also require biochemistry and some of your social sciences like psychology, things like that. They've changed some of the entrance stuff. The biochem, I think, is to make it a little bit harder because it's not hard enough. And then and also, so you have a foundation in it when you go in. You really do need some sort of foundation in biochem to do the classes that you have at the first year of med school for the traditional route. And then they started incorporating more of the social sciences because they're trying to make sure that we're empathetic and not robots and can relate to other people. Or if we can't relate, at least pretend we can.
Wow. See, that's what I'm saying. Yeah, that's what I'm saying. Every doctor I know, like, it's either like that's all they know. It's either the doctor and stuff, and they don't know anything else. So I think that's powerful. I like that.
Yeah. Actually, today I heard about an anime that I felt really bad that I had never heard of it before. So now I have to go and watch it.
What's it called?
It was like Demon Slayer.
Okay. All right. Boy, anime.
Oh God, I don't know if I want to watch that. And then the other one was something about like the first Titan, something Titan.
Probably Attack on Titan.
Yeah, that was.
Okay. Yep. That was hot. That was great.
Well, so I have all these teenagers in the clinic that, they love anime, and anime is having its big moment right now. And I feel like all I have is Avatar, The Last Airbender, and that doesn't get you very far.
Well, just for context sake, anybody who's listening to this is September 2021. We are still within the coronavirus pandemic. And at this time, anime is really taking off in mainstream pop culture. And that's why we kind of got onto this. So there's some context for anybody listening to this 100 years from now. So shout out to you. We're dead. Me and Lauren are dead now. And thank you for listening to us.
Maybe I'll have it on my grave. Demon Slayer for life.
Awesome. Well, okay, so when I was in college, the business majors, they'd always complain about the financial accounting class, how difficult that is. and all the pre-med majors would always complain about organic chemistry. Let's talk about organic chemistry. Is it as hard as they say? Why is it so hard? Is it even relevant to where you are now? Like, let's talk about orgo.
So it's a very abstract science. And here I'm actually pretty far removed from organic chemistry, and a lot of it I blacked out from my brain. But honestly, I think it has to do with the fact that it's very abstract and you're mainly working with only about 4 elements, and you can have all different kinds of reactions with them and all different kinds of configurations, and they all look the same. When you first look at it, you're just like, it's just all oxygen and hydrogen and carbon. I don't know what it's supposed to be. Probably just some more, carbon, oxygen, and hydrogen. I don't know. So that's how I felt the whole time. And I think it's one of the first classes that pushes you to have to truly study every day. And for a lot of people who are pre-med, like myself, studying was like, going to class, you did the homework, and that was your studying. And then you were good. But I think it's really one of the first classes that forces you to learn how to study in an effective manner and truly learn concepts and apply them. And that's a lot of what medicine makes you do as a physician later on.
Okay. Yeah. So, okay. What do you have to do? Like, now you're practicing, right? You're a resident, you're in Las Vegas, you're on the pediatric track. What does, as a practicing physician, what does studying look like? Because the hospital's got to make money. At the end of the day, we live in a capitalist society. It's about seeing patients. Actually, I want to hear about that too. Okay,
yeah.
But we'll get to that. So first, like, how do you actually practice as a physician and like research for your cases? Or I don't know what's it called. Are they called cases?
Yeah. So a lot of it goes back actually to medical school. Like, once you're actually in medical school, you are taught to think in a very specific way. Okay. So I think that's what leads to a lot of physicians having a hard time relating to people, is because we're taught to think in such a different way that we have to then retrain ourselves to think in a way where you don't have access to all this knowledge in your brain.
Okay.
So really, you're always studying, you're always learning. It's one of those professions that's always evolving all the time. So when you're in med school, you're constantly studying more like lecture notes, flashcards, rote memorization, and then you apply it to their basic questions that will give you a scenario. Oh, this patient is this many years old, it's a female, they're Asian, and they have a killer headache. And so you're taught to think, oh, is this like Takayatsu arteritis or something crazy? Wow. That everyone else would have been like, well, have you drank water and had some ibuprofen?
Okay.
So those are things that I have to remind myself, like, what would I do first if I had a headache? Let me see, am I dehydrated? So in med school, you're just like taught all these crazy things that you should think of when people say certain words or say certain symptoms they're having. You're supposed to have kind of a, like a list of of things that you should know, or of things you should be thinking of and ruling out with the other questions you're asking. So it's a constant puzzle, and it's a constant application of strategy and coming to your diagnosis. So that's really what a physician is for. We're there to come up with a diagnosis, to come up with a treatment plan, and that's what really distinguishes us from the rest of the medical system. Because we're really the ones who put into action, okay, we've decided this person has asthma. Okay, well, everyone else is like, oh, asthma, cool. And, there's a whole treatment plan that's very common that most other people like nurses, PAs, they'll all know as well. But also in the back of my head, I'll have, well, if it doesn't work out, then I have these three other things that it might be later on. So when you become a physician, a lot of your studying is where you can fit it in. So as a resident, for me, a lot of it's very much like an apprenticeship. It's much more of that. So you kind of start that at the end of med school with your 3rd and 4th year clinicals, where you go to clinic, you go to the hospital, you follow the residents or the attendings around, you see patients with them, and you are really learning on the job, because a lot of it has to do with person-to-person interaction and the physician-patient relationship that you establish at your first visit and every time after. So you get to learn that specific person, because not every person is a textbook, and not everyone's going to present in a way of a textbook. So a lot of your learning is actually experience, and that's what the training of residency is for.
So residency in general, you know, a lot of people have seen Grey's Anatomy, and I know just from my friendship with you, and I have a few other friends who've gone through the crucible that is residency. What I want to know is, like, everybody that I know that's in residency, it's really like 12 to 18-hour days. Like, do people drop? It seems like people don't seem to drop out. One, like, because at that point they've already graduated, they're in residency. Like, is there like a burnout? Because this is over what? How long is residency? 4 years? 5 years?
So it depends on what you do. So I'm doing pediatrics. So pediatrics and family medicine and internal medicine are 3 years. And then after that, those are the shortest. And then it goes up to 7 with like neurosurgery. And I think that's the one I definitely know. So it's 7 years. General surgery tends to be 5. And then there's all different kinds of other things as well, kind of all in the mix. There's a lot that are around 4. And then people also subspecialize and they do fellowships. So that's where you go and you do maybe something specific. So I would have the option as a pediatrician to do pediatric cardiology or pulmonology, GI. I couldn't go into surgery. That's something you do first. Unless I was crazy and was like, oh, I want to be a surgeon now and do 5 years of surgery. And usually that's not the case. So.
Okay. Well, so why is residency so arduous? Like you finish med school and then now you go into the work world where you are literally just working your butt off all day, all night. Why is it like that? Like, do they tell you why?
The shortest answer is because it's always been that way.
Okay.
And it's a patriarchal hierarchy that's been in place. It's very militaristic in a lot of ways, where you pretty much are ranked. So, you know, as a PGY1 or an intern from Grey's Anatomy, like, oh, we're interns, intern, me. Okay. Those, you know, all that they say. So it's pretty much the first year, and that's where your learning curve is probably the biggest one. And you're on the bottom of the totem pole as far as residencies go. And there has been a very big culture shift with residencies where it used to be very malignant, is the word that they use a lot, where it was so gruesome and you would be in the hospital for 48 hours straight and you wouldn't sleep and you'd see tons of patients and then the attending might show up a little bit, but there's a lot more regulations with it now. We're technically not supposed to go over an 80-hour work week, but there's some rules with that if you're not technically seeing patients and you're just finishing your paperwork or notes and stuff, that doesn't count towards your hours. So a lot of times when people are staying a lot later, it's because they're finishing notes. And I have to say that residents are definitely the ones probably putting in the most orders, doing the most documentation, and probably generating the most profit, is especially if you're looking at what our salary is versus how much work we're doing. And our output is crazy. And we generate a lot of money for the hospitals with all of the orders that we do, with the procedures that we accompany. We're cheaper than an MP or a PA. We're cheaper than a lot of nurses. Even though the culture's changed where we're really not running our own labs or taking care of patients in the way that they used to make residents do. I think the culture is much better across the hospital where if you order labs, you're respected enough that, you know, someone else is going to do them. And you certainly have plenty of other work. You're not drawing the labs yourself. There's phlebotomists for that. And the nursing staff are much better skilled and way better at it than I am.
Got it. So there's like a hierarchy of paying your dues in regards to doctors themselves, right? With attendings and the years of residency. Would you say PGY 1?
Yes, so postgraduate year 1. So there's a lot of vocabulary and it's like a whole other world of things. So thanks for clarifying. So yeah, so postgraduate year 1, you're graduated medical school, you are a physician, you have a license to treat, but you are not allowed to treat without the supervision of an attending physician who has already completed their residency and then board certification.
Okay, so do you ever run into resistance from patients? Like, it's like, oh, I know this is a resident. I don't want to be serviced by this provider because this person doesn't know what they're doing. Has that ever been a thing?
Yes. So absolutely, more so as a medical student.
Okay.
I think most people, when they go to certain hospitals, they know there are residents there. So if you go to a big university hospital and you have residents and you have a team of doctors, most people actually really appreciate it because they end up being seen by more than one doctor.
Okay.
You get seen by the resident, possibly the senior resident who's overseeing the whole floor, and then your attending physician. So you have 3 doctors' eyes on you. And some people really appreciate that. It's a lot more attention. You tend to get, you know, anything subtle tends to get caught and seen because you just have so many hands on you. Also, you know, it can be frustrating because maybe you don't have a great resident and they're not good at communicating and maybe their skills aren't very strong. And then it is very frustrating because you will see them attending for maybe a minute.
Wow, I see. It's sort of like going to the dentist. You know, you see everybody but the dentist and you see the dentist for like 3 minutes.
Yeah, exactly.
If that.
Right. I can remember the dental assistant, her name was Beth. And it took the other day, I had to actually Google my dentist's office and be like, I don't know who my dentist is.
Wow. Yep.
So,
well,
yes.
Well, that takes me back to capitalism in general. So just for the audience, which is international, we live in the United States of America where healthcare is not government sponsored, and there's a lot of for-profit hospitals. Therefore, especially with like the dentist example we just went through, these hospitals make money by how many patients that the doctors can see. And so there's a whole infrastructure around doctors being able to see more patients. So Dr. Lauren, I want to ask you about specifically what you thought of as an 11-year-old, as a child, of like delivering care and medicine. And then you get into the real world where you've got these capitalistic monetary incentives where it's really not necessarily like tell us about the balance between actually caring for patients and the capitalistic incentive to see as many patients as possible so we can get these bills up.
Ooh,
what is that like? Because
so,
you got into you got into do good, and that's so this is my perception. I don't know. It's not necessarily what it's about.
No, that is really spot on, and that is a great question. It's just such a weighted question, I think, for a lot of people. So because if you don't charge people, you won't get paid. And if you don't see a certain number of people, your office can't stay open. You can't keep the lights on. You can't pay the people that work for you. You can't buy the supplies for testing and, you know, all the gloves you need or paper and gowns, whatever. So, you know, seeing more patients pays more bills, more money in your pocket for maybe expansion or, you know, you paying off loans. So I would say from when I was a young girl, I had a very different perspective because a lot of kids in this country are very aware of the cost of going to the doctor. For most people, it's very costly. If you have regular insurance, you have a copay. Your parents might not have the copay. I've talked to friends who they said that they needed a surgery and their parents pushed it to November because they knew that would be after they made their deductible. So the surgery wouldn't cost them $5,000. So that's something very real for most people. And then there's also the side of Medicaid, where if your family qualifies or makes below a certain income, you as a child have free health care up until 18. And that's what Medicaid is for. And then pregnant women are also covered because of prenatal care that leads to a healthier child that technically costs less. A healthy child costs less to the healthcare system. I had a unique experience because I grew up in the Navy. So in the Navy, it is truly like a whole socialized system where everything is all through the government. It's the Department of Defense. Everyone has one insurance, which is TRICARE. If you go to a Navy facility or military facility, everything is paid for and you have no copays. There's no issues with having to, worry if your kid is sick. Oh no, I don't want to, maybe we'll just write it out. No, you could just take them and it doesn't cost you any money. It's all included with being part of the military. So that was never an issue. So if we had sniffles and didn't feel well and we had a fever, my mom didn't write it out. She took us straight to the doctor. And if we had strep, we got our antibiotics within 20 minutes because the pharmacy, the lab, everything was all right there. And you just got it all done immediately. It also was the first institution to have an electronic medical record. So I've had an electronic medical record almost my whole life. Okay. I think since 4 or so. So if I'm sure I'm wrong. But you also get like the first, you tend to get the first vaccines for things. I got the chickenpox vaccine. Really young, most people my age, they're either half or half. They either got it or they didn't, depending if they had good insurance or not. And I was definitely one of the first kids offered it. So it's a very different perspective. And even now, my parents, all their stuff is covered. My dad's part is a veteran, so all his stuff is covered. If he goes to a military base, all his meds are free. So I had a very different perspective, and I really never thought of the money part. I just knew that I would have to take out loans to go to med school. And back when I was trying, loans weren't nearly as insane as they are now. Okay. So that's the long answer.
Okay. Yeah. So I have another difficult question for you, which is, so this is something that a lot of people don't know about the medical profession. I have a friend who's an orthopedic surgeon, and he kind of like scoffs at the idea of internal medicine doctors and ER doctors. He kind of sees them as a lesser tier of doctor. Can we just talk about the hierarchy amongst doctors themselves? Like, I had no idea this was a thing, but it is a consistent thing with this guy. Maybe it's an orthopedic surgeon only thing. Can we talk about this?
All right, so it's definitely an ortho surgery thing.
Okay.
Because they're all bros, they all hang out. This is the stereotype. They all work out together for 2 hours every morning, before they go around, and then they go hang out, and then they all eat protein shakes, and then they all, if you look at any ortho residency, you're lucky if you find a person of color, let alone a woman. And they're all male. They all were athletes at some point. So they all like hammers and chainsaws and things like that, things that go, break bones, things like that. Mostly fix them. But so yes, that's definitely a thing that I've encountered before. And it's very funny because usually internal medicine docs, family med, pediatrics were the ones who actually care for the patient medically.
Right.
And a lot of orthopedic surgery is elective.
Right. So,
Which
okay,
means-
define elective,
which means
because like,
you
I don't
don't
know if
need
people
it.
understand what that means. Yeah, you don't necessarily need that surgery. Yeah.
So like if you have arthritis and you get a joint, like a joint replacement, you don't need it to live. You feel like you do because it hurts like a bitch, but you could live without it. You could just keep living, be like the old grandmas in the South that sat on the porch in a rocking chair and live out your days drinking wine. You know, you could do that if you wanted to. So yeah, maybe not the most necessary. General surgery tends to be a lot more necessary, or even elective too. So I think a lot of things in medicine are elective because you're uncomfortable, and so will make things more comfortable for you. But primary care tends to be things, well, if you don't do this, your life will be shorter, or, you know, things like that.
Wow.
So, but yeah, definitely. There's definitely like, you know, stereotypes and things from different specialties. I'm a pediatrician, so the stereotype is that we like to dress up, we like to play with toys, we're silly, we love Disney movies. It's actually a requirement. You need to know all the little kid shows, things like that. You're generally really fun, which other doctors find overbearing and too much. But most people like us, we tend to be the nicest. So that's the stereotype. And it's like, oh darn, that's the worst stereotype. So so it's funny. There's a lot of memes on the internet about all the different specialties.
Okay, yeah. Well, so I think we've been able to discuss a lot of things. I don't think a lot of people necessarily know about, you know, the medical profession, and like, you know, just like the hierarchy, like the capitalistic nature of the profession, and like balancing that with your desire to deliver care. Let's actually like zoom back in time to, I mean, even possibly during residency or before that, like what is tell us a difficult time that you've encountered during this journey to becoming a doctor.
I think a lot of steps are really hard. Each step is very stressful. It's a lot of pick me out of a lot of other very qualified people. I would say my first difficult part was just probably taking the MCAT, learning how to actually study for an exam like that, and learning how to manage stress on that level. Because if you don't do well, you don't get in. If you can't pass, the chance is way lower. But I would say the worst for me was actually once I got into medical school. I had always thought, oh, once I get in, I'll be fine. I'll be okay. You just get through, you do it, they let you go on. But for me, it was very difficult. I struggled a lot academically once I got in, and I actually had to repeat for a class. From first year, I had to repeat it right after. And then during my second year, I had to repeat a couple other classes as well. So that was extremely difficult, but also I think it's really made me a better person. I don't wish it on any person ever, because it was so heartbreaking going through it at the school I was at. I had very little support from the faculty. They were very condescending and not understanding and unflexible. Doctors really make terrible teachers for the most part, because they don't know how to teach in a way maybe someone who's a different type of learner needs to learn. So it's, you know, a student maybe like, you know, you have a lot of kids in elementary school who have different learning styles that a lot of teachers know how to do the, you know, different techniques to get them to learn a concept. Medical school, they don't, not at all. So I had to figure out a lot of things on my own. And I don't think I could have done it without my husband, your best friend, Jordan. He has a very like, fuck it mentality of like, you know what, if they don't like it, too bad. And if, you know, you really want something, you need to just fight for it and keep going. So that was something he really encouraged me to do. And something that if you have any other people who do grad school, you have to write a personal statement saying why you want to do something or why you want to be a doctor. And the best advice I got was to reread it. And it was me talking to me saying all the reasons why I wanted to go to med school and be a doctor, not anything else. And I reread it so many times to just get through an exam or to get through maybe a hard time. And I learned how to define myself differently. I used to define myself first as smart. And I had to change that because that's a very fluid concept.
Right.
And so instead I started doing it actually on personality traits, not how I could produce. So to me, being smart was, getting A's, doing well in school, being tough, having this whole thing of, being smarter than most people in the room. But when you go to a room where there's 250 other people who are also just like you, who are you then? You're all the same.
Right.
So I think that really helped me become more of just a little bit more down to earth in a lot of ways, and has made me more go with the flow in many ways. So a lot of things don't bother me like they used to, because just whatever that's not actually that important. Things that are most important, are your friends and family. If you're religious, your spirituality is super important, and those things can never change. That love for other people and that clarity you can get from your spirituality. So, all other things can change very easily. So I think that really helps me a lot.
Yeah, I really deeply appreciate you sharing that with us, because society is going to hold you because, you're a doctor. This is one of the most well-respected professions in our society. And you sharing that with us, anybody who's listening to this, who's thinking about becoming a doctor, or, just looking for motivation, or, who knows, you might just be listening just because it's fun. So
yeah. We fail.
Yeah, exactly. Yeah, I love that humility. A lot of people I feel would not be willing to share that. And so I kind of want to echo and piggyback on top of that. I had an IQ test when I was in second grade, and my IQ was at 129, or that I was testing either for gifted or I was being tested to skip a grade. I was 5 or 6 years old. I was in kindergarten, and I was being tested to skip into first grade because I was just acting up in class or something like that. They did an IQ test, and that IQ lands in the 97th percentile of everybody that is around. And so in my whole life, a lot of people told me I was smart, and it was always part of my identity. And then I went to school. Yeah, I went to University of Florida, and I was studying mechanical engineering. So University of Florida is one of the best schools, and it's still even just a public school. It's a public school, so we're not even talking about Ivy League.
top five this year.
Yeah. Oh wow, yeah, go Gators. So yeah, so it's an excellent school. So it attracts the best, and of course, mechanical engineering, you're going to attract a higher level amongst the best. And so even at a state school, there was a time when I was sitting in these classes and I was sitting in these labs with other engineers. And I was thinking to myself, I was like, dude, I'm probably in in your mind, you kind of we're primates at the end of the day. We're always ranking ourselves relative to everybody else. And I was thinking,
comparing.
Right. In my mind, I knew I'm in the 97th percentile of intelligence of humanity. And I'm sitting here in this class of 40, 80 people. And I'm like, dude, I'm not it. This is, so that's what you learn. What's funny is when you're in elementary school, or when you're playing team sports growing up, you might be the all-star on the team. But as you rise in life to higher levels of competition, it's just, comes a point, almost, I'm sure everybody runs into it, unless you're there's always someone better than you out there. And so like, I think there's always a room
Absolutely.
for humility. Yeah. Humility is important, because at the end of the day, there's somebody who's just destroying you. And no matter what industry, what realm, whatever you're doing, dance, martial arts, like there's somebody
no one
out there.
Can be J-Lo, okay?
Right, exactly. So yeah, I appreciate that, Dr. Lauren, because at the end of the day, like you didn't have to share that. At the end of the day, like people are just gonna be like, oh, she's a doctor, like that's awesome. And her husband's a lawyer, and like, wow, like what a household, like.
Yeah, but we work really freaking long hours, and gosh, it sucks sometimes. And that's us doing well.
Yeah, exactly.
So
right.
That's us doing just our basic jobs, is working like hell. So, but I think definitely for your listeners, comparing yourself to others is just awful. I mean, it's something you can't help but do, and it's something that I've always done. And that's something that I think that going through that process of, being truly separated from my class twice, really made me have to just be like, all right, who am I? This is Lauren, the entity of, what am I going to do? Are all these other people have ambitions like me? No, they have their own plans. And I have mine, and that's just how it's going to be. And I think it's interesting going from a really giant class of like 230 students. I always say kids because by the end it felt that way. They were like students that are turning 21 in my class, and I'm like, okay, creeping on 30. This feels too much. So now that I'm in residency, it actually goes to a really tight-knit group of people, because we spread out to all different hospitals across the country, and we disperse all over. So now I'm in a group of 10 people, and it's a little bit more of like a small pond. And I think that so far, the first 4 months, I've definitely been thriving a lot more. And I think for a lot of people, the first few months are really difficult with intern year, because you've worked more hours than you ever have before. For a lot of people, it's their very first job they've ever had.
Oh, right. Yeah.
Yeah. So it's their first job. They're like 30. I've never had you're 30. So, because I was non-traditional, I worked during college. I had a job for a couple of years before going to med school. While I was in med school, I also had a part-time job. I walked dogs while I was pregnant, and retaking some classes. And so for me, going to work and having a job, I'm like, this is great. Whereas for other people, just having a job itself was so anxiety inducing that they've been having a hard time with it, because they're not on their own schedule like before. When you're a student, you wake up at the time you want to wake up for the most part. You watch your lectures, you go to class, you have all this free time. You schedule your study time and you schedule your free time. And you're still working a lot, but it's still very much kind of on your own terms. And you're really not bothered by anybody. And if anyone's ever been to a hospital, you never get to work uninterrupted, ever. Never, ever, ever.
At the hospital?
Yes. So there's just always something going on. Somebody needs something. Different orders need to be done. Different medicines need to be given. Or maybe a patient, their vitals have changed suddenly, and you need to run in and, is their airway okay? Do you need to do CPR? Lord. Do you need to give them oxygen? Do you? And
you were talking about children.
Yeah. And your parents, parents want to talk to you. You have orders to do. You have notes to write. You have to talk to your attendings about plans. You're constantly having to communicate with all the nursing staff about different things. Nurses will bring up different concerns they have about their patients. So it's constant. So I think a lot of people really struggle with it. And I've certainly had my days, but I think that because I've gone through so much adversity to get here, it's not affecting me nearly as much as maybe others. So.
Right. Oh, okay. Yeah, you know what you said that was really interesting because I've known you a long time, Lauren. And so, and I think about like the stresses I had in college and the stresses you had in college and even high school. I know high school is probably even more difficult. You've said that to me before, which is high school because you went to a very rigorous high school. It was actually more difficult than college, right?
Yep.
So, okay, you talk
Hands
about
down.
like, and what?
Hands down, for sure. I would never do it again.
Yeah, so like you mentioned about like being able to handle stress a lot better. And I think about that now when I look at the college, like when I look at like a Florida Gator game and then I look at the kids in the crowd and I'm thinking about, you know, they're stressed out. I remember being stressed out and going to a Gator game to like release some steam. And in my mind now, when I look at them and I think about the stresses that I'm under now, especially as you get older, like, of course, like you have a son. My parents are getting older. Our parents are getting older. It's something that is always strange, like watching your parents get older and like, you know, they were your heroes growing up. But anyway, that's another story. But
Yeah.
what do you think about like just especially now, like as a practicing physician, you know, you literally have life and death in your hands. We're talking about children. Like this is much further than what you thought. What like you were completely freaking out in high school, but now the stresses that you're under now in regards to managing a marriage, like managing your relationship with your son, your child, like, and now you're holding life and death in your hands, and it sounds like you're like, you sound like you're managing it pretty well. That's what it sounds like. Mentally, you're in a good place. Like, how did you arrive there when back in college, like you and I both were kind of like just freaking out when our load was so much less than?
I think it's just, it comes with age. And then, you know, this has been 10 years in the making. So this is not an overnight thing. This is something that we've both had our own different journeys and ups and downs, and you have to pick yourself up by your bootstraps. And I hate that saying, but but it's true. And you get it done because no one else is going to do it for you, and no one's going to say, oh, poor you, like, hey, you're sad, oh, you're stressed. No, because the thing is, after so much time, you realize once you get things done, that's when your stress mostly goes away, because you're like, oh, I finished, okay, next thing. So
right.
And then you pick up skills and coping skills and different things like that with how to cope with it. And there's definitely days that are very stressful, and but there's different, mature coping mechanisms for stress that are helpful. Staying organized, time management, planning ahead. That's why I've studied for so long. That's why they make you study for so long for medicine, is so that once you get to this point, you should know what's going on. And then, they have this structure also so that if you really don't know what's going on with the patient, you have another physician who has a lot of experience and years under their belt that they'll, they can come and help you. So like right now I'm seeing a lot of well babies and cute kids in the clinic. And as an intern, they're very nice. And they give us like a lot of healthy kids so that we feel comfortable with healthy kids and doing just regular appointments. And then in a more second year, you're doing a lot more of managing sick kids and like their health care and things like that. And so they challenge you incrementally. And as a med student, we would have maybe a load of 3 or 4 patients at a time. And then now I have a load of more like 10 patients at a time that I manage for the day, and see that all their needs are done. And then, a person above me manages me, like 2 interns, me and another intern. So that's more like 20 patients that they manage and oversee. They make sure that we're not, screwing it up.
Wow. So let's talk through a typical day for you, which is you're a practicing physician. People, you're 11 years old, you had this dream, someone else is there may be a 13-year-old out there who's listening to this, who's got this same dream. What does your day look like? Like, what are they, what does it actually look like realistically?
So as a resident, it's a little Yeah, so as a resident, so a typical day in the hospital, if you're a physician, is you usually get up around 4 a.m., something like that, and you go to the hospital. For me, I go to the hospital around 5 in the morning, and I will look at the charts of the patients that I know that will be on our team, and I'll read through overnight events, I'll read through their chart. If I don't know the patient, so oftentimes they're there for a couple of days. If I was there yesterday, then I have to know about a lot of the patients and I'm just looking at updates. Or if it's a totally new kid, I have to kind of educate myself about the person, why they're there, things like that. And so I spend about an hour doing that. And then at 6 a.m. is what we call sign out. And that's when the night team will sign out the patients to me. So they will give us overnight events and they'll tell us about each patient. And it's a lot of closed loop communication in order to have continuity of care. Okay. So then as the team, I'll be with a couple other doctors, we'll have the 4 and we divide up the patients. So I have my, 10 or less patients that I go see. I'll go see all of them. This is between 6:30 and 9. I'll go see all of them and write their notes for the day, the progress notes, with their plan. And then I update orders if anything needs to be added, look at their labs. And then I will then, around 9 to 9:30, the attending physician, that's when they come in. So once you're older, you've gone through residency and you're the attending physician, you get to come in at 9, 9:30, 10, really whenever you want.
I see.
They have more normal hours, but usually they have also already read about all the patients and they have their own sign out from the night attending. But I've definitely have already been there for 5 hours or 4 hours. I don't know, 4 hours. And so then we do a couple hours of what we call rounds. And that's when I present each patient to the attending and I go through their whole history or just their overnight events, my diagnosis and plans for the day. And then also we try to think of when are they going to go home, because we don't want you in the hospital. Ideally, you don't want to be there. Like the point is to get you well enough so that you can go home, because being in the hospital for more than you have to is actually detrimental to your health. It's not comfortable, it's loud. You actually hardly ever get sleep there because we're always poking you and bothering you, taking your vitals, things like that. So if you're not sick enough to be there, you should leave.
I see.
So that gets us to about lunchtime. We'll finish up some orders, change any notes I need to for a plan. We've updated all the parents at this point. And then we usually, oftentimes I get lunch around 12, 12:30. And then the afternoon is, if we haven't had any admissions by now, typically the ER has some kids that need to be admitted to the hospital overnight. So I'm the one who goes sees them in the ER and do their admission. So that involves different orders, a different type of documentation when they first arrive called a history and physical, where I do a very thorough history, medical history, and ask them all the millions of questions of, where were you born, with surgeries, hospital stays, past medical history, meds, allergies, a whole slew of things. And so we'll do that for the rest of the day. And then things will also come up throughout the day too. That, you get labs back, kid will come back from surgery. You're usually rechecking the patients multiple times. And then by the end of the day, which is around 5:36, you sign out to the night team. So it's a hospital day. And it can be all over the place. Sometimes it's really stressful. So that's kind of my major tasks, but, going to the hospital, a lot of these kids, might need some oxygen support. They need special diets. They have different types of tubes that they eat through, and if they can't eat on their own. So there's a lot of different details that go into different things. Common things I see are like asthma, bronchiolitis, pneumonia, infections, seizures is really big in little kids. We've seen a lot of COVID, what's called MISC. That's a complication of it. Those are some major ones. There's all different kinds of things that kids come into the hospital for. You get some really sad things too. You get a lot of times kids are stuck in the hospital because of social circumstances with their families, or you know, they don't have insurance. Here in Nevada, we have a huge undocumented and immigrant population. So we have a lot of kids that need treatments or care at home that they can't afford and don't qualify for because they're undocumented or they don't have insurance for some reason.
Wow.
So a lot of social things that can be really sad, but they're so cute.
Well, yeah. That was very sad, and that's so cute was very unexpected. Or they're so cute. They are so cute, yeah.
They're so cute. So anytime I have a chance, I take a baby and I hold them for a while. I had a baby that was in the hospital where the mom, they were suspected of congenital syphilis, so he had to be treated for 10 days in the hospital. And so poor baby was alone a lot because mom was a single mom, had other kids. It was the start of school year, so he was very sweet. And we all the staff, we were all holding him, feeding him, so he wasn't alone all day. So those are the kind of sad ones, and they're all alone. But also at the same time, I get to hold them all day. So
that's great.
So I get my baby fever out. I'm like, oh, I have baby, okay. So,
well, Doc, I gotta ask you the money question. Well, not money, but was it worth it?
I think so. It's definitely been my dream. I'm so happy it's done. You know, there were a lot of tears of joy when I matched. I probably cried for an hour straight.
What is matching?
Matching is when you are selected for a residency, and that's when you're told, yes, you have a job. That's a whole topic in itself. That really needs reform, because not all medical students automatically get a residency spot, which really leaves a lot of people just hanging, who it's like, you have all these skills to be a doctor, but no skills to do anything else. So it makes it really hard if you don't match. So, and because I repeated, I had a high chance of not matching. So the fact that I did was certainly, you know, I had a lot of people who said, you know, it's very unlikely I'll match this year. So I was definitely discouraged quite a bit. So there was a lot of tears of joy on that day, and then just graduating and finally making it. It's like, so it just feels really good to finally be on that side.
I love it.
Yeah.
Well, what's next for you? What year of residency are you in now? And like
just the first year. So I have 3 years total. So I have quite a bit here in Vegas. So, you know, we'll have some fun for sure. Already went to a spa. It was great.
Awesome.
And then I don't know. So the goals is probably general practice, general pediatrics. I would love to own my own place, maybe have a couple other branches. I would love to have some different services offered, like nutrition, have an emphasis on like holistic medicine, which is really the cure for a lot of childhood diseases, is the need to just be a kid and eat healthy, real food and play for, you know, for an hour a day. That's all we really need, but a lot of kids don't really get it. So, you know, and I don't know, advocacy is something I'm really into, which is like more legislative type things. Advocating for children on a legislative level is something I've become really interested in the last couple of years. So I'll probably end up being a part of some different organizations, things like that. So we'll see.
Awesome. Okay. Sounds like there's a few different ways that this could end up. So that's great.
Yeah. Yeah. Ultimately, a business owner would be great, and make my own rules, have my own culture, you know, pay employees well, so that they stay and make their lives well, you know, happy. So
Right.
that's some of my goals.
That's awesome.
Yeah.
I love it. Well, I think this is a good place to hang the hat. It's 11 p.m. or no 12 a.m. where I'm at, and so I'm fading. But it's not because this wasn't great. This was actually wonderful. So
Yeah, this was fun.
Thank you so much for being on.
Yeah, this is awesome. Thanks for having me.